Welcome to the Kentucky Education and Labor Cabinet Office of Occupational Safety and Health online training resource. This course is presented as a service of the Division of Education and Training. Please pause the presentation and read the following disclaimer. When you are ready, press play to continue. Welcome to the course Suicide Awareness and Workplace Prevention. This course is intended to provide employers within the Commonwealth of Kentucky a basic understanding of suicide, how to recognize warning signs, and available resources. Before we begin, if you or anyone you know may be at risk for suicide, please take action. A great resource to use is the 988 Suicide and Crisis Lifeline. This lifeline provides free and confidential support for people in distress. The line is available 24/7, so you may dial or text 988 at any time. Spanish and veteran options are available as well. When you call or text the 988 Lifeline, you will be asked if you are a veteran or if you want to be redirected to a Spanish speaker. For more information, please visit the website 988lifeline.org. Here's the same information given on the previous slide, but translated in Spanish, along with an attached link to the Spanish version of the 988 website. The first part of this module will cover what suicide entails, including the definitions, statistics, warning signs, and other information to help spread awareness and educate employers. First, we need to distinguish the difference between these terms: suicide, suicide attempt, and suicidal ideation. The definition of suicide is death caused by self-directed, injurious behavior with intent to end one's life. A suicide attempt is defined as a non-fatal, self-directed, potentially injurious behavior with intent to end one's life. And suicidal ideation is thinking about, considering, or planning a suicide. The latest published statistics on suicide by the Centers for Disease Control, or CDC, is the year 2022 as of May 2024. Within the nation, suicide rates have increased 36% between the years 2000 and 2022, and it is said to be the 11th leading cause of death in the U.S. Suicide was responsible for 49,476 deaths just within the year of 2022. This averages out to roughly 136 suicides per day, or one death every 11 minutes. Men also died by suicide nearly 4 more times than women did, and 68% of those males who died were Caucasian. Suicide affects millions of Americans each year. Just within the year 2022, 13.2 million Americans thought about suicide, 3.8 million Americans made a suicide plan, and 1.6 million Americans attempted suicide. For every one suicide death, there are 11 suicide-related emergency room visits, 52 self-reported suicide attempts, and 336 people who considered suicide. The rate of suicide varies depending on different factors. These factors include race, ethnicity, age, financial status, and location. Certain groups of people have higher than average suicide rates. These include veterans, people living in rural areas, LGBTQ+ members, and certain occupations, which we will discuss later in the module. Here's an infographic provided by the American Foundation for Suicide Prevention that provides an overview of the nation's suicide data rates. The fact sheet reports 54% of Americans have been affected by suicide in some way. Out of the 49,000 plus Americans that died by suicide, 55% of them were by a firearm, and 56% of firearm deaths were suicides. Although men died by suicide 3.85 more times than women, women were actually 1.3 more times more likely to attempt suicide. 90% of those who died by suicide had a diagnosable mental health condition, but only 46% of Americans with a mental health condition received treatment. According to federal guidelines, 73% of communities in the United States do not have enough mental health providers to serve all residents. Here's another visual showing the suicide rates among the U.S. broken down by state. Kentucky is in the middle third of the suicide rates in the U.S., which is represented by a medium blue color. This graph provides a visual view of the Commonwealth of Kentucky's suicide rates compared to the nation's rate. Kentucky's average suicide rate was 17.98 per 100,000 individuals, meaning for every 100,000 Kentucky residents, Nearly 18 of them die by suicide. The United States suicide rate is 14.21 per 100,000 individuals, making Kentucky rates higher than the nation's rates. As you can see by looking at the graph, over the past 10 years, Kentucky, which is represented by the blue line, has consistently stayed above the United States, represented by the gray line. The table shown organizes Kentucky's suicide numbers from the years 2017 to 2023. As you can see in the highlighted sections, the total number of deaths by suicide for each year stayed relatively consistent, presenting minimal change. Looking at the sex and race categories, you can see the prevalence of suicide amongst white males is much higher than females and any other race. Over the last 7 years, approximately 79% of all people who died by suicide in Kentucky were of working age. This making the workplace the most cross-cutting system for suicide prevention, intervention, and crisis response. Suicide can be a difficult subject to address. Therefore, many people feel they don't have enough resources or knowledge to help. In fact, 2 out of 3 adults believe they are not confident enough to recognize suicide warning signs in others. Although 8 out of 10 adults stated that they are open to learning how they can do more to help someone in need. Now I will go into the warning signs of suicide to help employers gain a better understanding of suicidal cues. I have broken down the warning signs into 3 categories: behavioral, physical, and verbal. The first set of warning signs we will discuss are behavioral signs. Behavioral signs possess negative emotions such as feeling empty, extremely sad, trapped, hopeless, or even full of rage. Some people can even develop personality changes and appear to be anxious or agitated all the time. Someone who is suicidal might also experience extreme mood swings, the want to be alone, withdrawing from social contact, or preoccupied with death, dying, or violence. The next set of warning signs are physical warning signs. Physical warning signs can be shown through change in normal routines, such as developing different sleep or eating habits, an increased use of alcohol or drugs, missing work, or prior obligations. Some more physical signs include performing risky or self-destructive actions, giving away personal belongings, getting affairs in order, such as making or finalizing a will, conducting research on ways to die, making a suicide plan, or obtaining the means to take one's own life, such as buying a gun or stockpiling pills. The third and final set of suicide warning signs are verbal signs. Verbal signs can be anything from expressing those negative emotions mentioned earlier, having serious guilt or shame, feeling like a burden to others, believing there's no reason to live, or saying goodbye to others in a manner where they'll never see them again. So more verbal signs include making suicidal statements such as, I wish I were dead, I'm going to kill myself, I wish I hadn't been born, or any other negative statement regarding being alive. We've looked at the warning signs, but what are the causes of suicide? Suicide is the result of feeling hopeless for the future. When a person struggles to cope with the overwhelming situations, it can lead them to believe suicide is the only solution. Suicidal ideations, suicide attempts, and suicides are significantly heritable phenotypes. However, the extent to which these phenotypes share genetic architecture is unclear. Unfortunately, minimum data is available on the biology and chemistry of suicide due to the difficulty of conducting research without crossing ethical barriers. There are many risk factors to account for when dealing with suicide. A person can be at risk for suicide if they have attempted suicide before, feel hopeless, worthless, agitated, or lonely, are socially isolated, or are currently experiencing a stressful life event such as loss of a loved one, going through a breakup, military service such as deployment, and financial or legal problems. A person can also be at risk if they struggle with substance abuse, have easy access to firearms or other lethal means, or are diagnosed with a medical condition such as chronic disease, chronic pain, or terminal illness. Underlying psychiatric disorders, including depression, post-traumatic stress disorder, and bipolar disorder, can put someone at risk, as well as family history of any mental disorder, substance abuse, suicide history, or violence on any level. Being a part of the LGBTQ community, residing in an unsupportive environment can also put an individual at risk for suicide. Thomas Joyner, a clinical psychologist, conducted his own research on why people die by suicide. He found that among the many people who have considered, attempted, or died by suicide, have three common factors that mark those most risk of death: the feeling of being a burden on loved ones, the sense of isolation, and the learned ability to hurt oneself. The desire to escape overwhelming emotional pain combined with the lack of fear puts that individual at very high risk for suicide. A common misconception of the term suicide survivor is someone who attempted suicide but then lived. Although the term suicide survivor actually pertains to an individual within the family or friend group of someone who has died by suicide. An example of a suicide survivor is the mom of a daughter who took her own life. The mom is a suicide survivor of her daughter. Each person who commits suicide leaves behind at least six suicide survivors. And these survivors can go through many challenges themselves, including a traumatic aftermath, having mixed emotions on the situation, or dealing with reoccurring thoughts about suicide. Diving into the challenges suicide survivors face, I'll start with the traumatic aftermath of a suicide. Death by suicide is sudden, sometimes violent, and usually unexpected. Suicide survivors might have to cooperate with the police and face the press immediately after their loved one's death, which can be overwhelming. The survivor then feels the need to stay strong to be able to communicate with authorities and press properly, even though the grieving stage is being interrupted, giving them little time to process the situation for themselves. Suicide survivors will go through mixed emotions regarding the suicide. They can have feelings of anger, rejection, or abandonment. On one hand, a person who dies by suicide may appear to be a victim of mental illness or intolerable circumstances. But on the other hand, the act of suicide may seem like an assault on or the rejection of those left behind. To put this into perspective, think about the survivors of a homicide. They tend to direct their anger towards the perpetrator, the one who took their loved one's life, although in a suicide, the victim is the perpetrator. This can cause a clash of emotions, leaving the survivor at a loss. Suicide survivors will replay the suicide in their mind repeatedly, leading to the potential development of post traumatic stress disorder and anxiety by involuntarily reliving intrusive images they've created. They will think about the circumstances of the situation, their loved one's final moments, and their last encounter with that person. A moment of intense pain and hopelessness can generate impulsive suicidal behavior, although a crisis only lasts minutes and suicidal thoughts will pass. In suicidal people, brain imaging and behavioral studies show thinking is less flexible and more negative, but helpful interventions are available. Specific treatments include medication, psychotherapy, along with self care activities, have shown to help people manage suicidal ideation and behavior. In conclusion, suicide is a major public health concern, a leading cause of death, and super complex. But one thing that everyone needs to know is that suicide is preventable. Anyone and everyone can help prevent suicide. You can do this by learning the warning signs, promoting prevention and resilience, and committing to a social change. Suicide prevention requires strategies on all levels of society. So let's look at these on the next slide. The CDC breaks down society into four levels. First, you start with the individual themselves. Then you have that individual's relationships that they are a part of. Next is the community that the individual and their peers reside in. Then all three of these levels make up the society. Prevention methods exist in each societal level, and achievement of these methods will reduce suicide rates significantly. The first level in a society is the individual themselves. This level identifies biological and personal history factors that increase the likelihood of becoming a victim or perpetrator of violence. Some of these factors include age, education, income, substance use, and the history of substance abuse. Prevention strategies at this level promote attitudes, beliefs, and behaviors that prevent violence. Specific approaches may include conflict resolution, life skills training, social emotional learning, and healthy relationship skills program. This includes an individual's closest social circle peers, partners, and family members who influence the person's behavior and contributes to their life experience. Prevention strategies at this level may include parenting or family-focused prevention groups, mentoring and peer programs designed to strengthen parent-child communication, and promoting positive peer norms, problem-solving skills, and healthy relationships. The third level explores the settings such as schools, workplaces, and neighborhoods in which social relationships occur. This level also seeks to identify the characteristics of these settings that are associated with becoming victims or perpetrators of violence. Prevention strategies at this level focus on improving the physical and social environments. This can be achieved by creating safe places where people live, learn, work, and play. Addressing other conditions that give rise to violence in communities, such as neighborhood poverty, residential segregation, instability, and the high density of alcohol outlets within the area. The fourth level of society looks at the broad societal factors that help create a climate in which violence is encouraged through social and cultural norms that support violence as an acceptable way to resolve conflicts. Other large societal factors include the health, economic, education, and social policies that help maintain economic and social inequalities between different groups in society. Prevention strategies at this level include efforts to promote societal norms that protect against violence and efforts to strengthen financial security, education and employment opportunities, and other policies that affect the structural determinants of health. Now that the basics of suicide have been covered, let's tie this into the workplace. Here's a quick 4-minute video providing an introduction on workplace suicide.
Hello, I'm Hayward Donegan, President and CEO of Value Options. Like many organizations, Value Options is on a continuous journey toward achieving a culture of health. When we envision a healthy workplace, it includes a focus on the employee's emotional health and well-being. Today, 20% of Americans suffer from some type of mental illness, and far too often, those who need assistance never seek help. It's important that we address these concerns in the workplace too. For that reason, I want to talk about a subject many business leaders are uncomfortable discussing: suicide. In any given year, for every 1,000 employees, 37 will seriously consider suicide. 10 will make a suicide plan, and 5 will attempt suicide. Suicide can bring the workplace to a standstill. Each of us can play a role in stopping this critical public health issue. Business leaders can promote help-seeking behaviors within the workplace, and individuals can take talk of suicide seriously. Suicide warning signs like giving away material things, hopelessness and despair, and frank talk of ending one's own life cannot be ignored. Anyone can suffer from suicidal thoughts, young or elderly, male or female, and no matter what position they hold. But fortunately, suicide can be prevented. We must be proactive in getting employees the help they need before they reach such levels of despair. Be prepared. Let's make sure tragedy like suicide does not have the opportunity to affect the workplace. The National Action Alliance for Suicide Prevention has united leaders from both the public and private sectors to reduce suicide in America. Value Options is proud to be affiliated with this noble mission. Business leaders are recognizing and getting involved because they see the importance of preventing suicide. Employees are a company's greatest asset. Unrecognized and untreated mental illness, absenteeism, and stress cost companies millions of dollars in lost productivity, disability, and workers' compensation claims. And more importantly, it causes an incalculable human toll. That's why it's vitally important to foster a more emotionally healthy workforce. To save lives in our workplace, here are some steps Value Options is taking, and we encourage other business leaders to do the same. Promote the National Suicide Prevention Lifeline, 1-800-273-TALK. Engage, promote, and utilize the Employee Assistance Program. Provide training to all employees to recognize signs of a suicidal person and to know how to respond. Participate in workplace mental health screening days. The actions of leadership and every individual within an organization can promote a healthy and safe workplace that prevents the tragedy of suicide. For a list of resources, please visit the National Action Alliance for Suicide Prevention website, www.actionallianceforsuicideprevention.org.
In 2017, nearly 38,000 persons of working age died by suicide in the United States, resulting in 40% suicide rate increase in less than 2 decades. Suicide rates were significantly higher in 6 occupational groups: construction and extraction, installation, maintenance and repair, arts, design, entertainment, sports and media, transportation and material moving, protective services, and healthcare support. The industry groups with significantly higher suicide rates include mining, quarrying, oil and gas extraction, construction, other services such as auto repair, agriculture, forestry, fishing and hunting, and transportation and warehousing. Just to highlight one of the main problem areas, construction is known to have one of the highest suicide rates amongst all professions in the US. The number of construction workers who lost their lives to suicide were 5 times higher than the general population suicide numbers. Workplace-specific suicide risk factors include low-skilled work, lower education, lower absolute and relative socioeconomic status, work-related access to lethal means, and job stress due to poor supervisory or colleague support, low job control, and job insecurity can increase the risk of suicide amongst your employees. Here's a quick 30-second video on 5 things to know about suicide prevention. The next 3 slides contain 6 overall suicide prevention methods. The first method is to create protective environments by reducing access to lethal means among persons at risk for suicide, creating healthy organizational policies and culture, and reducing substance use through community-based policies and practices. The second method is to improve access and delivery of suicide care by covering mental health conditions and health insurance policies, increasing provider availability in underserved areas, providing rapid and remote access to help, and creating safer suicide care through systems change. The third method is to promote healthy connections by promoting healthy peer norms and engaging community members in shared activities. The fourth method is to teach coping and problem-solving skills by supporting social emotional learning programs, teaching parenting skills to improve family relationships, and supporting resilience through education programs. The fifth method is to identify and support people at risk by responding to crises, planning for safety and follow-up after an attempt, providing therapeutic approaches, and training gatekeepers. Suicide prevention gatekeepers are people who are likely to observe changes in mood and behavior in others and can link those at risk for suicide to help. Then the final method is to lessen harms and prevent future risk by intervening after a suicide, also known as postvention, and reporting and communicating the news about the suicide safely. When working with suicidal individuals, you need to be direct, talk openly and matter-of-factly about suicide. Be willing to listen, allow expressions of feelings and accept the feelings. Be non-judgmental, don't debate whether the suicide is right or wrong, whether feelings are good or bad. Don't lecture on the value of life. Get involved, become available and show interest and support. Offer hope. Alternatives are available, but do not offer glib reassurance. Take action. Remove means like weapons or pills. Get help. Seek out people or agencies specializing in crisis intervention and suicide prevention. Be conscious of your facial expressions. Look of shock will put a distance between you and the individual. Seek support. Avoid being sworn to secrecy. And lastly, use appropriate terms. Examples of appropriate verbiage are given on the next slide. When speaking about suicide, the language used plays a big role in the stigma behind it. You want to use terms and phrases appropriate to the weight of the subject. For example, you want to say died by suicide versus committed suicide. Suicide death or attempt versus saying successful or unsuccessful. Working with versus dealing with suicidal patients. When describing the behavior, do not describe it as it being attention seeking or a cry for help. A comprehensive approach to addressing suicide within your workplace can include suicide postvention, intervention, and prevention plans. Suicide postvention is the planned steps to provide evidence-based support following a suicide loss or attempt within a workplace. Best practices include immediate and ongoing support to mitigate future risk from suicide exposure. Suicide intervention is the planned steps to provide compassionate, competent, person-centered care for individuals experiencing suicidal thoughts and behaviors. It should be readily accessible and reviewed often. Suicide prevention is the planned steps workplaces take to generate an environment that promotes positive coping skills, reduces stigma, and normalizes help-seeking behaviors and increases mental health awareness. All industries and occupations can benefit from a comprehensive approach to suicide prevention. The CDC's Preventing Suicide Technical Package provides strategies with the best available evidence to prevent suicide and can serve as a resource for many employers. Some specific strategies from the CDC's technical package for preventing suicide linked on the slide include referring workers to financial and other helping services, facilitating time off and benefits to cover supportive services, training personnel to detect and respond to suicide risk, creating opportunities for employee social connectedness, and integrating workplace safety, health, and wellness programs to advance the overall well-being of workers. More workplace strategies include increasing access to health and behavioral health care services, reducing access to lethal means among persons at risk, and changing organizational policies and culture to promote the protective environment for all workers. This can be accomplished by promoting pro-social behavior among employees, assessing and referring employees to helping services, and developing a crisis response plan for post-suicide event. Most people who die by suicide are of working age, and many workplaces are not prepared to help employees at risk for suicide or how to properly respond to the suicide death. Promoting mental health and wellness in the workplace will not only support suicide prevention, but it will also increase productivity and well-being amongst workers. Anyone in an organization could be potentially trained in what is known as a suicide prevention gatekeeper. Gatekeeper training allows employees to be knowledgeable in identifying people who may be at risk for suicide and how to link them to care. By increasing the number of gatekeepers within the community will increase the likelihood that people at risk for suicide will be identified earlier in the progression of suicidal thoughts and behavior. This will reduce the possibility of a catastrophic outcome. Most suicide prevention training programs consist of a workshop and appropriate accompanying educational materials. The organizations linked on the slide provide various suicide prevention training programs, including pre- and post-vention plans, screening tools, gatekeeper training, and other online educational information. These resources will help companies create a work environment where employees and managers are more knowledgeable about suicide, more prepared to help colleagues, and more prepared to act. The next two slides contain more resources pertaining to suicide and employer involvement. In hopes you are more aware of suicide risk factors, warning signs, and causes, always remember that suicide is preventable. Help is available. The QR code provided will take you to the 988 website, and I encourage you to navigate through and become familiar with the different resources and information available. This will expand your knowledge even further and help you feel more prepared if someone you know or even yourself is struggling with thoughts of suicide. This concludes the presentation, and for more free online learning resources, please visit our website at kysafe.ky.gov. Thank you.